because you have hospitals that are not close, um, what are you doing today that could help provide that support?
Yeah, one thing that we just recently have done, and it is in conjunction with eVisit, which is our telehealth platform. We have rural sites, so you did allude to it. We're metro and rural, so we have several rural locations, and we have calls that come into a centralized call center. We also had, like most people, we've had a workforce shortage, and we had to rethink how our triage calls came in. And so if we had somebody that called with a headache, their blood pressure was elevated, they just didn't feel well, maybe it was an earache in a child or a fever in a 2-month-old, many times those calls were going to a triage nurse, and then we have what's called symptom screener, and we would determine whether they could be seen tomorrow, needed to go to the ER. But with our leaving of our triage nurses, one of the things that we realized is that we did have access, but we also were not using our telehealth and our digital capabilities to the fullest extent. Also, when somebody calls in from our rural site, the closest hospital may be an hour away, and ER is not always, one, it's never the most financially feasible option, but two, it may not really be a good due to transportation. So what we decided to do was a pilot, and it's working very well, to say, we're just going to put these people on a telehealth visit with a provider. We're going to add them onto the schedule. We have the capacity, and that may be their rural provider. Ideally, that would be the one they see. But if not, we have capacity across our organization. And so we ended up doing this pilot, and it's worked really well. So we've been able to increase, we have about 20 additional patients seen per day across the organization, just by calling in and saying, I have an earache, or I think, I'm having some, tightness in my chest. It's not chest pain, but I just, don't feel well. And this has really improved our patient satisfaction. It's improved our provider satisfaction. It's actually then decreased our ER utilization, which is one of the measures that we're counted on for our value-based care. And so we're really excited about where this is going. We're going to build on it. And it's been really a great partnership, and how we can help, especially our rural communities that just don't have the ability, maybe even to get into the clinic based on where they are.